Hello and welcome to this episode of Business on the Wire. This one sits at the intersection or crossroads of where health and economics meets. As we stepped into 2020, something that came down like a pile of bricks globally was the coronavirus and its impact. But what are the ramifications both for India and indeed in terms of corporates, businesses and economics? Joining me to talk about that is a man who understands the world of medicine and the impact of something like coronavirus very, very deeply, Dr. Srinath Reddy. He's president of the Public Health Foundation of India. Thank you so much for joining in. I think the problem is too much information in this case, Dr. Reddy. So I want to start with where we are at this point. From what we know and what we've gathered, where do things stand?
Well, as far as the epidemic is concerned, China is fighting hard to contain it. But obviously, many areas in China have been affected. They're in lockdown, and travel to and from China is highly restricted at this point in time. Within India itself, a few cases have been reported, mainly of people returning from China in Kerala, and they've been quarantined, they've been tested and released only after they've been cleared of the viruses. And there are also monitoring efforts being made at all ports of entry, and surveillance is going on. At the moment, more cases have not been reported, but we still have to maintain our vigilance because a number of asymptomatic people who are carrying the virus and are unaware of it can still be infective. So we'll have to be very careful about the virus slipping through and keep a watch till the global epidemic gets contained.
What's also amorphous at this point, Dr. Reddy, is the numbers in terms of the reported deaths, one from the government and the numbers that they report versus what the estimates are doing the rounds outside, and more importantly, how many people stand afflicted and affected by that?
Well, actually the problem is that the diagnostic tests will have to be widely available in order to get the correct numbers. And also now China has revised its diagnostic criteria by using some other techniques as well, including the CT scan criteria and so on. Now the problem is very simple. The actual severity of the virus in terms of its virulence is estimated by the number of deaths among the number of people infected. If the denominator, which is the number of people infected, is expanded by using different criteria, then the virulence estimate comes down. On the other hand, if the actual number of cases infected is underestimated, the virulence is overestimated. So we'll have to be very careful because a large number of asymptomatic people who suffered with the infection in a very they did not suffer or they had a very minimal effect on them, may not have been counted. On the other hand, if we actually underestimate the virulence, then we are getting into serious trouble about neglecting the people who are likely to have been exposed. So we are still watching the situation. At the moment, it's fairly clear that the virulence is not of the same level as SARS. But the infectivity is much, much higher. That's why we are seeing more deaths than SARS, because a lot more people have been infected. But I believe right now the numbers are still uncertain in terms of the actual number exposed. We only have information about the deaths. The denominator, the number exposed, is not very clear.
Lying beneath the human impact and the human damage is of course the economic impact. And the problem also, as I was saying earlier, is too much information and perhaps too much speak about this. I was looking at a recent report by a Harvard public health professor who made the point saying, and I'm quoting, "It's likely we'll see a global pandemic. If that happens, 40 to 70% of people worldwide are likely to be affected or infected." Is there a degree of panic in the reportage that you see that you think ought to be scaled down?
Everybody who is working with influenza epidemic modeling across the world are expecting that there would be something like the 1918, 1919 influenza pandemic to occur sometime this century. They actually say
it's just what and when.
It is not the question of whether it will happen, but when it will happen. and that we should be prepared for it. Now, we still can't be 100% certain with that doomsday scenario, but there is a great likelihood that if it's business as usual, the way we are actually creating conveyor belts for viruses from wildlife to migrate into captive veterinary population and then into the human habitat, then the likelihood of viruses spreading, multiplying and mutating to more virulent forms, that danger really exists and escalates every day if we continue to practice the same kind of eating habits, the same kind of trade and export habits of animal products, then we are in a bit of trouble.
I want to talk for a bit about the preparedness of India. Would you say it is quite diverse considering how large India is? And do you think the ports of call that have been set up, which are the airport checks, are enough?
Clearly, they cannot be enough because they are being checked at airports. There are some land entry points also which are being checked. But given the porous nature of many of our entry points, where people can slip through without adequate evaluation, we cannot be absolutely sure that we are keeping the virus away from our shores. True, people returning from China are being scrutinized very well, but there are a number of others who might have been exposed to people who have carried the virus from China, let us say to Europe, and there at a conference people might have been exposed. They come back without a Chinese stamp on their passport. They are not very rigorously checked at the airport. Somebody coming from Frankfurt is not being checked at the airport. But on the other hand, he could have been sitting at a dinner in Frankfurt, at a business dinner with a Chinese gentleman who might have been exposed and asymptomatic. So we cannot be 100% certain that we are keeping the virus out of the country.
Kerala has been at the forefront both in terms of having spotted this and dealt with it. On the 14th of February, the Kerala Chief Minister tweeted out saying that the 3 cases have actually been confirmed as fully recovered. At this point, there is no case of secondary spread. Is Kerala more prepared or more open with its information and outreach?
I think there are a number of factors which have made Kerala stand out. Firstly, Kerala has had a good primary healthcare system.
Yeah.
In fact, it's got even better in the last 2 years. So net result is, even at the level of the sub-center or the primary healthcare center, where people go for a fever or feeling unwell, these can be actually picked up, and if the index of suspicion is high, they can be referred for evaluation. Secondly, the literacy rates are much higher. The people themselves are much more keenly aware of what's going on, and then they are likely to self-report. But even more importantly, the experience with the Nipah virus just about a year and a half ago has made Kerala much more vigilant in terms of spotting outbreaks and responding to them in a timely manner. So the system, which was already fairly adequate in terms of its good primary health care and other referral systems, is now better poised and prepped for dealing with an outbreak.
Two-part question, Dr. Reddy, before we get to the economic impact of this. A, have we been able to successfully find the exact source? Are we all, are we all on the same page about that? And B, there were reports that the government of India had allowed the restricted use of a combination of drugs widely used for controlling HIV infection. Does that seem at this point the best alternative to be dealing with this virus?
See, there was all kinds of speculation about where the virus arose from, including snakes and so on and so forth. But bats are generally the prime suspect mostly. And then there was a question about bats and pangolins in China, in the wet markets, intermingling and then possibly having a cross-species transmission of the virus. But it is true that you can actually have transmission from one species to another species, but particularly the fact that bats, which were hitherto confined to wildlife, are now becoming part of the human habitat because of deforestation and spread of the cities and urban areas, is providing an opportunity for the viruses to get easily transferred from one animal species to another animal species. And once the crossover occurs, they can actually multiply So we know that there are a number of species that can be affected, whether it's avian influenza or swine flu or whatever we want to call it. There are a number of species which are vulnerable. But the main problem is the way we have actually created these conveyor belts for viruses to transfer from wildlife into veterinary habitat and human habitat.
The economic impact. The first concern, of course, is supply chain disruptions globally. What do you know at this point in terms of how hard it's been hit?
Well, clearly, I think we have been fairly euphoric about globalization of trade and economies, but negligent about the globalization of viruses. The viruses,
even though that's been the more successful
yes, the viruses
transportation,
viruses are much faster in their transmission, and they happily using all the channels that we have created for globalization by way of trade and human transport to their advantage. So there we have to be very clear that our investments in a globalized economic model of trade is going to carry a penalty when the national borders are shut down, either by way of exported goods not going out or having import restrictions. We have seen some of the import restrictions from sanctions, but this is a sanction because of health reasons. And what we are now seeing is that automobile industry in South Korea is being shut down, but what I am much more worried as a public health person is what it is doing to the pharmaceutical industry in India, which is again very important from the point of view of saving lives.
On that very topic, Dr. Reddy, on the specific issue of antibiotics and APIs, and you know how large China is as a market, how badly do you think we have been affected already in terms of supply?
We have been very much affected because we are heavily dependent on imports of APIs from China. And we have seen that about 63% of our active pharmaceutical ingredients are actually imported from China. We import about 50,000 crores worth of active pharmaceutical ingredients every year, out of which 63% are from China. And if you take the top 20 APIs, 68% of them are from China. Almost about 103 crores, 1,000 crores worth of pharmaceuticals to almost nearly the whole world. And now those exports will get affected because our own production facilities are now slowing down.
I wanted to confirm these figures with you if you had a sense of them. Some reports indicate that Indian companies imported bulk drugs and intermediaries worth about $2.4 billion from China. Would you say that's an accurate figure, or do you think it might actually be higher or lower than that?
Well, the figures I have are that we have about almost, we import about 50,000 crore rupees worth of drugs, of APIs every year, and about 63% of them are from China, and 68% of them of the top 20 APIs that we import.
There are reports, Dr. Reddy, of specific API prices having already shot up.
Yes.
Could you give us a sense of the extent of that?
Yes, a number of prices have suddenly increased, almost some of them have gone up almost double. But we have to be very careful about ensuring that they are controlled, and the government is now trying to come up with control measures. One of them, of course, is to try and prevent exports. See, if you are, of course, we owe it to our people to ensure that drugs are available without hindrance to our people, ultimately. But you're also having a very export-oriented market of pharmaceutical industry, and that shutting down of exports is going to affect, firstly, the health of other countries, which is not a great thing to do, but also hurts our economy because our earnings are going to go down. So from that point of view, we ought to really have a clear look at where things went wrong. About 25 years ago, or about 3 decades ago, we had a substantial amount of production of our own APIs. We then started closing down our industries because importing from China was cheaper than producing in India, according to some of our industry experts at that time. So we said, why? That is, as I said, again the euphoria of globalization. Why should we even produce here when we can import from China? But then imagine, today it's a virus, tomorrow it could be trade sanction against China from, let's say, the United States of America. Then what happens? Then your whole industry is then compromised. It is absolutely important that we develop capacity within the country, including public sector capacity, for producing APIs and drugs. Now tomorrow, let us say we need compulsory licensing for a medicine. Now, if our public sector pharmaceutical capacity has shrunk and the private sector is not bold enough to take up the compulsory licensing because they don't want battles with multinational drug companies in international courts, you can't even use a compulsory license, even though the Doha Declaration permits it for public health purposes. So unless we start investing back again in developing our API industry, both through public and private domestic manufacturing, and also invest additional capacity in public sector manufacturing of medicines, we are going to be always very vulnerable to either these pandemics or trade sanctions, which may affect a third country. But if that is the source of our APIs, then we are going to be heavily compromised.
On a percentage basis at this point, what is your sense of how much API prices have shot up already?
Well, as I said, they've almost doubled in some cases.
Doubled in some cases. Where do you think the firms are at this point, Dr. Reddy? Because one sort of counter argument that they've put forth is that given the fact that India, in any case, functions with rather inefficient mechanisms, there's a lot of storage. And we did build stores for ourselves. That will run out at some point.
It is estimated that it will run out between 1 to 2 months.
Starting from February?
Yeah. I mean, it depends on which drug we are talking about. Obviously, everything is not stocked up to 2 months.
Yeah.
But it's likely to run out, most of the drugs will run out by 2 months.
And what position would these companies be at, economically then?
Well, there is some degree of domestic manufacture of APIs. As I said, 80% of our APIs are now imported. Yeah. It's only 20% as opposed to, let's say, 30 years ago. Now, we have to really start stepping up our domestic production and then hope that that will compensate for our drug manufacture, which already is now at about 40% of its capacity.
We talked briefly about how medical help has always not been available at the nodal points where it should have. I want to switch from what's happening with the pharma companies to the medical facilities we have, both in terms of preparedness and what kind of hit they may suffer if this actually escalates in a country like India.
Well, basically, I think if we have an outbreak which really spreads throughout India, we have to be firstly prepared for the fact that it's going to be a community infection. That means many people are going to be affected. We are going to see our healthcare facilities under great stress of people requiring admission. And even assuming that the epidemic doesn't grow more virulent in terms of the virus transformation, even if we are talking about 10% of the people becoming very sick and 2% dying, if they are going to be requiring respiratory care, the ventilators and then intensive care units, they may be in short supply, especially in Tier 2 and Tier 3 cities. You are not going to see that. And if it actually enters the rural areas, we are going to be in even more serious trouble. We will see our medical personnel, our entire health workforce being preoccupied with these and other medical conditions, health conditions which require treatment will always be affected. I mean, you can imagine the situation where a pregnant woman would not dare to go to a hospital for delivery because cases of this coronavirus are being treated over there. So you have a major problem in which our entire health services, partly because of diversion of healthcare personnel, but also because our hospital facilities are going to be now greatly focusing on treating the cases. The rest of the healthcare is going to suffer. and that's going to be a problematic scenario anyway. And once that happens, then you're going to see a great deal of productivity go down even in the rest of the industry and elsewhere, whether it's urban industrial locations or rural agricultural locations. If it becomes a community infection, you're going to see operations virtually stalled. And if you're going to be particularly quarantining people for 14 days at home, then where is the workforce? So let us hope that scenario will not evolve in India. Let us hope that all the precautions that we are taking are going to be effective. But I think the lessons are very clear, that you cannot always hope that it's going to end on a happy note with only 3 cases in Kerala. There can be situations, whether in this epidemic or in another epidemic, that we may become more vulnerable. So firstly, we need to strengthen our public health systems much better. Firstly, make sure that animal to animal spread is limited, animal to human spread is limited by the kind of wet market conditions that we also have. Secondly, we must make sure that our primary healthcare systems are excellent, so that early detection, counseling, home management can be supported, and only cases who need real intensive care are referred to other hospitals. You asked me earlier about treatments, about whether anti-HIV drugs are useful. Well, actually, there are a few antiviral drugs which have been helpful in anti-HIV. The idea here is that the same may be useful in the case of other viruses. No trials have been done, nothing has been proven. It's a question of trying to extrapolate theoretically that one antiviral drug can be useful against another virus. And we have no clear-cut experience even in the present outbreak that they are the most effective or they are really effective. So we have to really trust supportive care, which means if it is a milder infection, counseling, adequate amount of fluids, rest, nutritious food, lot of fruit and vegetables. If it is a more severe case, hospitalization, active monitoring for complications, respiratory support if you develop viral pneumonitis. Those are the kind of things that we need to do. But which means that our health systems will have to be much better prepared. We can't afford to flood our hospitals and tertiary care institutions with a lot of panicked mild cases which should have been handled in primary health care. So the Achilles heel of our health system response is going to be weak primary health care. So right from our public health measures to our primary health care system, we need to strengthen much more rather than depend only on the large hospitals which are going to crack under the pressure.
There is another alternate argument which is being presented, Dr. Reddy, especially for the pharmaceutical industry, touting this as an economic opportunity, that China's loss could be India's gain. Does it seem like a facile argument to you, or does it seem like something with potential, or are we just putting the cart before the horse?
See, I don't take a gravedigger's attitude that somebody else's loss is my gain. Of course, I recognize in business you are very competitive. I would rather say that first lesson to be learned from this is don't depend on China for your pharmaceutical industry APIs. If India has to have a robust pharmaceutical industry, we must have our own domestic APIs. I mean, the same pharma industry was very happy to get APIs from China rather than have APIs produced in India. So we must learn that there is a certain degree of self-sufficiency and self-reliance that's necessary even in a globalized economic environment, especially when it comes to essentials like health. So firstly, develop your own industry so that you don't have this kind of vulnerability. Secondly, as far as the global exports are concerned, certainly where we are competing for global market, we should try and be as competitive as possible. And we should try and see whether we can actually, both through our quality and price, command the global market, and that's a fair competition with China, fine. But I do not think we ought to pin the label of a virus affected or a virus generating country on China just to gain competitive advantage. I think that militates against the spirit of human solidarity, which must come front and foremost in any global health emergency. So I think we compete in business on fair terms, but I don't think we should be exploiting this to our opportunity. And secondly, let's remember, I mean, I'm not an economist, I'm not a great expert on how the world economy is going to be coming up, but we have a huge demographic advantage of young people. China has an aging population. They have a huge amount of capital they are sitting on. If we can actually collaborate in certain areas with our human resources and their capital, we can actually, for the good of humanity, really produce a lot of things which will be inexpensive, high quality, and meet the needs of the world. So in a sense, we can also become together competitive in certain areas if we collaborate. So I do not look at the future purely in terms of competing with our neighbors, but also looking at self-sufficiency as the first and foremost priority, but then collaboration in important areas where we can actually do good for ourselves and for the rest of the world.
Finally, Dr. Reddy, you've seen many of these waves and
No,
many
but
of
one other
Yes,
area I would like
please.
to say. One of the other lessons I think we must learn from this is, why did Indian students go to Wuhan for medical education? Now, all
As they earlier used to go to Russia. It looks like this is the new...
No, they used to go to Russia, they used to go to Belarus, they used to go to a number of East European countries, because we did not allow enough number of medical colleges to come up in this country. The Medical Council of India actually adopted a very restrictive pattern which benefited a few medical colleges, especially the private medical colleges, and did not allow enough medical colleges to come up with all kinds of arbitrary criteria. And if you had 4,000 Indian medical students traveling to other places in the world of uncertain standards of medical education, coming back, I used to be the chair, I used to be heading the president of the National Board of Examinations, which used to conduct some of the entry tests for the people coming back from other countries with medical degrees, because before they were allowed by the Medical Council of India to practice, they had to pass this examination and do an internship. The results used to be dismal, 10 to 20% maximum pass rates. Here are people who have studied abroad, but their educational standards do not meet our requirements. On the other hand, if we had opened medical colleges in district hospitals of India, in Bihar, UP, Central India, Northeastern India, allowed enough opportunities for our people to be trained in our country to meet the needs of our country with greater familiarity with the conditions of our country rather than the familiarity with the conditions of Belarus, we would have been in a different place. But we have now forced our students to go to Wuhan, and when they get caught there in an outbreak, either they are quarantined there or we bring them back and then put them in quarantine here. This is another lesson of self-sufficiency and that we must learn, not just the question of APIs. Our medical colleges must accommodate the aspirations of our young people rather than forcing them out into other countries.
And the potential economic loss we're probably dealing with by allowing these students to receive that education somewhere else.
Precisely.
That's actually, the point I was coming to, which is that you've seen a lot of these historical trends and waves. At this point, what we also have is too much information, perhaps something we didn't have in the SARS period. If you had to set out, one or two or three key lessons that you hope people, especially in India, both corporate and otherwise, take away from this entire episode, which is still unfolding, what do you think those should be?
For the sake of our health, for the sake of our what's called health security nowadays, that's a term that's being used, as well as for the sake of climate change, let us consume less animal foods. Let us not have ecological despoilation which actually destroys our forests and then creates these conveyor belts for virus transmission. So that's the first lesson that I think we must learn. Second, of course, is that even in the era of globalization, we do need self-reliance, particularly in the area of health and health products, like for example, pharmaceutical industry, where we are really looking at self-sufficiency in our active pharmaceutical ingredients and drug manufacture. Third, strengthen public health and primary health care systems so that if there is an outbreak, we catch it early and curb it early rather than let it become a wildfire. So if we ignore these lessons, we may not be as lucky in the next outbreak as we seem to be at present.
It's been a fascinating conversation. Thank you so much for your time today and for speaking with us. Thank you.
Thank you.